Hello friends, the question is what is psoriatic arthritis and how to know that it is arthritis and how does it begin and how to manage it, how to control it and how to avoid it. So we are going to talk completely about psoriatic arthritis today from the very beginning. So psoriatic arthritis is a type of arthritis which occurs in almost 50% of the psoriasis patients and which is a very devastating disease that can cause you the deformity of the joints and that can limit your mobility and motion. So one has to be very aware of about it to avoid it and to know it at an earlier stage, because if the stage is more, you cannot control it. Your joints are bound to damage because of psoriatic arthritis. So how does it occur? Usually we notice that before psoriatic arthritis occur, there are earlier signs. That is, when you get up in the morning, you feel little tired and your body is stiff. We usually notice that when you move on or when you do the warming up or little movement in the body or take your bath, it disappears. So initially you notice the heaviness and stiffness of the body. Then you notice the heaviness and stiffness of your joints. You feel that your joints are getting stiff. So you just move on, it goes away. So motion relieves the stiffness. So this is the second stage of psoriatic arthritis. Then you notice that there is suddenly swelling around the joints. The swelling of psoriasis is like the sausage-like swelling. When you eat the sausage, complete sausage-like swelling of your fingers. That is a characteristic of swelling in psoriatic arthritis. So that is when you get a sausage-like swelling, that is beginning of psoriatic arthritis. So here you should be very careful. So you must take the medications to relieve the swelling. And when you have psoriatic arthritis at this stage, so you have to do exercise. Although it pains, but go on moving each joint of your hands or your feet so that it does not fuse, and take a treatment, because if you only take the treatment, that is painkillers, and control the swelling and do not move the joints, then it is going to fuse and cause the deformity. So one has to move the joints. I ask all my psoriasis patients to do movement of all joints so that you do not know where the psoriatic arthritis is going to begin. So in order to avoid the fusing of psoriatic arthritis, you need to do the exercise or move it. So if you don't move it, you lose the joint. The next important thing in psoriatic arthritis, I will tell you that whenever the cases of severe psoriatic arthritis come to homeopathy, if we treat it clinically, we can definitely give them good results. But by the time we cure them, that is a year or so, the joints get fused. But there at that time, we always take the help of modern science to control the swelling of psoriasis first so that joints can be moved. And we start homeopathic treatment and gradually reduce the doses of allopathic medicines, and completely when the psoriatic arthritis is controlled by our medicines, we stop those medications. So in case of psoriatic arthritis, I don't want to take a risk so that your joints will get fused, but I will take a middle way, that is taking both the treatment at the time. And when your joints are completely free, you stop the treatment, taper down the allopathic treatment and completely change to homeopathic treatment. And when homeopathy has completely controlled the psoriatic arthritis with homeopathic medicines, definitely you save the joints as well as you get rid of psoriatic arthritis. So this is very important. Another important thing I always tell you, the role of vitamin D and vitamin B12 in psoriasis, because we know that a lot of joint pains and swelling is because of lack of vitamin D and calcium in the bones. And if you have a deficiency of vitamin D, you need to take the supplements, and you must sit 10 to 15 hours in sun rays to get your vitamin D repaired in your body. So that is one of the regular exercise I always tell you, and always go on checking your B12 also. So these are two important things that cause or that affect the psoriatic arthritis, or it can help the control, or deficiency can definitely aggravate it. So psoriatic arthritis is one of the devastating and debilitating disease, and if it is not earlier diagnosed or if it is not well treated, it can cause damage to the patient's joints and his mobility can be compromised. Thank you.